I'm sure by this time you have heard of the diabetes miracle called Ozempic. And if you haven't, you've likely been hiding under some sort of a rock of sorts. Videos and posts singing the praises of Ozempic can be seen on every social media platform that exists. It seems to be all the rage, with ordinary people using it to help with diabetes and celebrities using it to lose a few pounds before the next red carpet event. Could Ozempic be the miracle drug that people have been waiting for? Hi, and welcome to Nature's Path to Wellness. My name is Wendy. Could Ozempic be what finally eradicates obesity and diabetes? Let's find out. If you are not familiar with Ozempic or how it works, it is in a class of drugs known as GLP-1 antagonists. Semaglutide, the active ingredient in Ozempic, reduces blood glucose through a mechanism where it stimulates insulin secretion and lowers glucagon secretion. Glucagon is a peptide hormone that is secreted from the pancreas in cases of low blood sugar. It is important to note that Ozempic has not been cleared in Canada for the use of weight loss, but many doctors in the US do prescribe Ozempic off-label to patients for weight loss. Wegovy, another similar product, has been approved for weight loss in Canada and comes in a higher dose formula, but it has not been sold here due to the global demand and shortages of the drug. Many doctors singing the praises of Ozempic further encourage more and more people to seek out the advantages of what the product claims it can do to help you. But one has to remember most doctors seem to push whatever is going to pad their wallets. After all, if any ill side effects happen from using Ozempic, for example, it simply means that they just have another prescription to write, right? But what if Ozempic is not all that it claims to be? Or rather, what if people see the product through rose-colored glasses, missing the potential dangers this drug and others like it pose? Dangers? That's right. Ozempic comes with a laundry list of potential hazards, and one has to wonder if the risks outweigh the benefits rather than the other way around. It is also important to note there is no long-term safety data on Ozempic, which is injected once a week due to the high dose of semaglutide. If you decide to use Ozempic, you get to be the data. I took a look online at the contents of the package insert, and I strongly encourage you that if you're going to be using any type of injection or medication, that you always take the time to read the package insert before using or taking the medication, um, just to know what the safety concerns are. And this is what I found. So in drugs.com and under Ozempic, I went into the prescribing information and the package insert. And so there are some things that I found kind of concerning. There is warning, a risk of thyroid C-cell tumors, down to further warnings and precautions. Pancreatitis, there has been reports of pancreatitis in clinical trials. Diabetic retinopathy complications, hypoglycemia, which can make sense because it is a diabetes drug and so it is meant to lower your blood sugar levels. However, acute kidney injury is concerning. Maybe hypersensitivity reactions that are serious could be a concern. Serious hypersensitivity reactions, for example, anaphylaxis and angioedema have been reported, and acute gallbladder disease. So these are some issues that I would consider um, quite serious and something to consider before using it. At healthline.com, I went and looked to see what some of the mild side effects of Ozempic are. And so the mild side effects that are listed are change in the way things taste, abdominal pain, burping, constipation and diarrhea, dizziness, headache, flatulence or gas, fatigue, lack of energy, indigestion or acid reflux, injection site reactions such as skin redness, discoloration or discomfort, nausea or vomiting, and minor increase in heart rate. And there are some serious side effects that are listed on this side as well. Diabetic retinopathy, which is something that can happen when you have diabetes. Um, so the change in the blood vessels in the eye, they become damaged. Gallbladder disease, including gallstones, kidney problems, pancreatitis, increased risk of thyroid cancer, allergic reaction, and hypoglycemia. Again, low blood sugar. And so another site that I went to online, verywellhealth.com, and is talking about the updated Ozempic label, and it notes a risk of intestinal blockage. So this was updated September 29th of 2023. Ozempic label now includes warning of intestinal blockage risks. So what does this mean for you? There is a risk of severe gastrointestinal effects. Ozempic and other GLP-1 receptor agonist drugs are likely rare, but it is still something to be concerned about. So in this condition called ileus, the food can be caused to build up and clog the intestine, sometimes leading to serious complications. Then you might wonder what happens if you take Ozempic, achieve your goals of lower blood sugar levels, and perhaps even some weight loss, and then decide that you want to stop taking it. That's a great question. A recent study showed that two-thirds or 67% of the individuals who took Ozempic and then stopped taking it regained their weight and often gained even more weight than what they started with and experienced a return to higher blood sugar levels along with hypertension. There are some misconceptions about the fat in your body that you need to be mindful of as well. Even doctors that a great number of people follow don't always get it right. So it's important to be sure to research everything that you are being
Early
told.
research coming out studying GLP-1 agonists that these medications, although they make your fat cells shrink, they also probably increase the absolute number of fat cells in your body.
So in this video, as you can take a listen, Dr. Ken Berry is telling us that the number of fat cells in your body can change. And that is simply not true. It's been well known for a long time that the number of fat cells that are in your body are basically established by the time that you are an adolescent. So some fat cells can die off and then eventually they're just replaced by the approximate same number of fat cells. What does happen is that fat cells can increase or decrease in size. So again, it's super important to always be careful about the information that you're being given. And I always encourage people that even information that I'm sharing, do your own research. Information that doctors are giving you, do your own research. It's very important. So it's important to note with respect to fat cells that Ozempic may decrease the amount of fat within your cells, but the number of fat cells is not decreased or increased after you stop taking Ozempic. So why do doctors keep on prescribing Ozempic if you will never be able to come off of it? Easy. How many of you have actually walked into a doctor's office with a diagnosis of some sort of illness or disease or whatever and been told that there is a natural way to combat the illness while proceeding to tell you about nutrition and other ways that will be helpful for you to get better? I can probably count on one hand on how many people have been told that. And maybe even none of you, by believing that diabetes and obesity are not your fault, that they are chronic and progressive, and that they are conditions that have been inherited, there's nothing that you can do about it to control it either, then doctors seem to have a customer for life. And unless you are willing to empower yourself with knowledge of how you can beat type 2 diabetes or obesity without pharmaceutical drugs, and until you realize that these issues are not just determined by genetics, but by your lifestyle and the environment, you will be the next victim of the chronic and progressive scam. You will be prescribed any number of drugs you are willing to take to manage the symptoms, and I can tell you most certainly that Ozempic, metformin, and insulin are not going to reverse type 2 diabetes. Only you can do that, not something that comes out of a bottle or a syringe. The important thing to note is that with drugs and medications, they do not in any way reverse the disease or illness. Instead, they simply mask the symptoms. You are not told by your doctor the way to get to the root cause of the problem by changing your diet, getting your hormones under control, and remember that insulin is a hormone, or incorporating some exercise into your day. Ozempic works like the hormone GLP-1, which tells your body that you are full. Only it's an artificial version, and it can tell your body that you are full without even having eaten anything. Think about that for a minute. With so many people hearing about how Ozempic causes weight loss, people were flooding their doctors' offices to get the drug without even having diabetes. Surprisingly, doctors were reluctant to prescribe a drug for weight loss that was meant for diabetes. So they, Novo Nordisk, which is the producers of Ozempic, came up with another drug called Wegovy. It has the same active ingredient, but in a higher dose, and it is being prescribed now for weight loss. So I seem to hear in the background that cha-ching at Novo Nordisk. So what happens if you take something like Wegovy or Ozempic and continue to eat the way that you used to, or even worse yet, you start to eat more because you feel like now you can. With delayed gastric emptying, you could end up with something called intestinal ischemia. Essentially, your intestines can become all blocked up. It may not sound all that bad, but imagine not being able to poop for an extended period of time and not just like being constipated. You can't even pass gas, and this can lead to extreme cramping and discomfort, food rotting in your intestines, reduced blood flow in the intestines or intestinal ischemia, and in time, death. This will be especially important to note if you've had any previous weight loss surgery where you can have scar tissue leading to a further increased risk. There have been reports of people who have used Ozempic and lost a lot of weight and then stopped using it, gaining the weight back to the point of being heavier than they were before they even started using it. And remember how I said that Ozempic is an artificial form of GLP-1? Once you are injecting artificial GLP-1, that hormone that tells you that you are full, and you keep putting it into your body stops making GLP-1 effectively on its own. So now what? If you go off at Ozempic, you have nothing to tell you that you are full anymore. This actually sounds just like a recipe for disaster. What happens if you're taking a drug that causes you to feel full without eating? So you stop consuming enough nutrients? You can become malnourished. And this is not the type of malnourishment that would be experienced in a third world country. It simply means that your body is not getting enough of the nutrients that it requires to function properly, leading to other problems like heart conditions, muscle loss, and mental health issues. So what do you do if you have type 2 diabetes? I can tell you that Ozempic or Wegovy are not the answer. You are going to need to work hard and change your lifestyle by changing what you are consuming. And I know that some of you will say that you don't eat too much or you don't eat too unhealthy. And while that may be true, we need to get to the root cause of your issue. A lot of times it has to do with balancing your hormones. And again, insulin is a hormone. Your hormones are messengers in your body telling it when to lose fat from the fat cells. And is one example. And when your hormones are not functioning the way that they should, Well, you get the picture. You stay overweight. I have done several videos on this channel about cutting sugar out from your diet and highly processed foods, which is a huge part of the problem for many. Something else you may wish to consider is moving to a whole food plant-based diet. Cutting out most of the animal products from your diet, getting insulin, that hormone, under control, and you will begin to see your blood sugar numbers improve. Your body will start to shed weight and you'll begin sleeping better and feeling better overall. The hormone leptin in your body will become more sensitive and it will be telling you that you are full at the right time so you can set that fork down and not overeat. Instead of having muscle degradation because of Ozempic, which is, by the way, a notable side effect, you will lose weight and retain your muscles. Your face won't sag, giving you that Ozempic face, but rather you will notice an almost immediate improvement in your appearance because the water retention in your body will go down, including in your face. I hope this video has been informative for you, especially if you've been considering using Ozempic. And if it has, I ask you to give it a thumbs up and perhaps consider sharing it with somebody else who maybe has been thinking about going on Ozempic or Wegovy. I look forward to seeing you next time here at Nature's Path to Wellness, where your journey to lifelong wellness begins. And until then, be blessed with good health.